you an answer in 10 minutes, let you know we accept the referral within 10 minutes, rather than wait a couple hours. So
Absolutely.
besides that, it's us that separate yourselves
I use
from.
my cell phone so much, I'll even circle my cell phone on the business card, and I give them a bunch, and I say, give it to your patients. I don't mind if they call me, have them call me if they have a question. If they're not sure, if they're not sure about home health, have them call me, and I'll circle my cell phone on my card.
In your case, you're on a rent. You can even tell them that you can start the case for them if it's necessary.
Here is DCS, just for those of you who don't know. She's DCS. Anybody else? Thank you, guys.
Hey Sharon,
Yes, sir.
I'd like to have my business card, I'd like to have my cell phone number highlighted.
Okay. So is that's the expert?
So, what were we doing, all business cards right now? Just saying?
It's kind of a two-part question, because I'm getting a lot of business from SNFs and doctors' offices, but hardly any ALFs. So I'm trying to break in and be preferred in a few ALFs. One part of the question is, do you guys try to get a nurse in the building, like rent space? And a second question is, when there is a nurse from another company already in that building, how do you get around trying to get patients in there? Like, what would be the angle to try to get in there?
I'm just gonna say right off the bat, let's find out what kind of licensing that they have in there. If they're part of their SNFs are selling nursing care, do they have nurses on staff? Some of them have a limited license as far as what they can do. They can do certain things. They can monitor blood pressures and pass meds and stuff, but some of them can't do wound care. They're not allowed to do that. So kind of need to.
So
kind
we
of need
could
to know
rent
what
like
kind of
office
license.
space and put one of our nurses in the building, right? Is that what you said that you had done in a couple?
If that's available,
Right.
For us to do that, and Leo will tell you more, Zeus, it'd have to be a 100-bed ALF or something big where there's a lot of opportunity.
Right.
But yes, if it's not within 15 miles of your office, you are able to open a wellness center or something.
That's correct. 10 miles.
Right. In other ALFs, when like nurse on call is already, or somebody
Correct.
is already in there with renting space, what would be the angle to go in there and try to get business when they're obviously just using nurse on call because the nurse is in the building?
You're bringing up a very emeritus group. Our nurse on call bought emeritus group.
Right,
Emeritus
right.
group
That's
bought
what I've
nurse
been
on call.
facing.
So even in our counties, nurse on call is sitting there. Those offices are very hard to penetrate, and that's when I even started by saying you got to do your homework, because we're never going to be able to get that office there because that relationship is the same owner owns both. So the way you'd be able to follow patients in that facility is by bringing it, by a doctor writing for you, or by getting it before it comes in. But if a patient's returning there or moved, it's probably already hooked up with nurse on call.
Well, like Stephen said, you have to do your due diligence before you go into these facilities. And if you know Nurse on Call or Brookdale has their own home health as part of that AL or IL, it's going to be challenging to be number one. But it's okay to be second fiddle. And so you really want to sell to our clinical differentiators. If they can't do behavioral health, hey, every single patient that moves in here and has a behavioral exacerbation, early onset of dementia or Alzheimer's, they come to me because we have the clinical team for that, the expertise to manage that patient and keep your residents aging in place.
How many ALs and ILs do you have in your area?
A lot.
A lot? Then don't focus on that one. Go to the next one.
very
I
good.
mean, don't even fool with that one, just go to the next one.
If the one
Probably
thing-
30.
Fight that battle later.
Yeah.
You don't have to do it now, just go to the low-hanging fruit.
Well, here's the thing, not all of them have somebody already in the building, but they have who they're using as obviously their preferred provider. So
Right.
going in and selling myself when they've been using the same person for 2 years, I was just trying to get points on
The other
how
ones
to
that are
handle
really
that.
easy to work with are the ones that have very few and they're brand new and just opening. If they're trying to grow, if you can work with that leasing director or their marketer and get out there with them, they will send you damn near every one of them.
Yeah, we just got into one
what
in
you guys are
Jersey,
doing
just
right now?
opened, Richard and I.
Hey,
Yeah.
Blair, can you tell us what you do with your activity directors?
Can y'all hear me?
Yep.
Really? I'm getting nervous for some reason. So, Every month at one of the assisted livings, actually a girl in the office, Anna, she's our office manager, she started this before I got there, but kind of taking it over. But we do activities with them, like you were talking about, Stephen. The first Monday of every month, I'm with the assisted side at 10, and I do some type of craft or education. And then the first Tuesday, I'm on the memory care side, and we do the same thing. So really, it helps you get to know the residents that are in there, and you talk to them, you kind of find out once you get to know them. Sometimes I'll stay after the activity and play Skip-Bo with the women, just to get to know them a little bit and see, you find out who's on service, who's had a recent fall. They all talk. They love to have somebody fresh and new in there. I mean, you can do the same thing at your SNFs. And my previous, where I was previously, I had a lot of SNF business, and it was because I did a lot of activities. It's a lot of work, but they want to show that consistency.
No, I don't need it, I'm good. I'm sorry, Sharon, you want me to have it? My question is, I know you guys are obviously top performers. I know that your day doesn't start at 8 o'clock. You're probably at a facility by 8:30, but my question is, your prep time to get there, I'm sure it doesn't start at 8 or 8:30. If you can talk to the room and tell them what your prep time is, so you have a game plan when you hit that day off, making sure, because I believe maybe some of the thoughts is, my day starts at 8:30, so that's when I'm gonna start prepping for my day and go as I work. So what is your guys' mentality on your prep time to get your day going moving forward? And when is that prep time set up? Is it set up the night before, or do you wake up an hour or so earlier and set it up to get you focused on your day?
At the beginning of my week, every week, or on Sunday night or Monday morning when I wake up, in my truck there's a pad, a notepad. On that pad, I write down everything that's, the fire things that need to be dealt with that week. And I make sure that it may be 20 things, it may be 10 things, but those are things that I'm trying to knock out that day. If something, I get distracted and can't do it that day, then that would carry on to the next day. But that's something that I do every single week, every single Monday, and that list is an active list that stays in my truck. And then, that's one thing.
I do mine actually the night before. So the night before, I guess I started on Monday. My weeks are so repetitious. I see the same people on Monday from 9 o'clock in the morning. I start in the office till 5 o'clock at night. Tuesday, I see the same people at the same time. It's just, so I start the night before. So Monday night, I'm organizing my Tuesday day, and I'm just trying to say, all right, I'm going to Dr. Stone's office. I'm going to see if he has any rehab pay. So I try to hit something, because you can't keep talking to these people about the same thing you got to switch it up and ask them questions that might generate business back. So you got to have that list the night before, so come Tuesday morning, you got your 20 stops there, you hope you're going to have time to do them all, and you have questions to ask them on how they might have potential business for us.
Again? The 20 stops?
20 stops?
Yeah, you guys heard that, 20 stops, not 5, not 6, not 10, not 12.
Those are the planned ones, Zeus. Then there's unplanned.
There's a lot of.
Or you get called into the hospital or a rehab, or you want to go see a patient that was already on service, for example.
Yeah.
Those are just the ones you're going to do anyways.
I was gonna say, like Steven, my routine is also very repetitious, so I know exactly where I'm gonna be most of the time. So it's like, you don't really have to plan for this, because you know what they like, what I do, like in planning in my mind, it's usually like that week I have to remember I'm big with the kids. That's how I have the relationship with all of these accounts. We do like the whole kid thing. So I make sure I remember not really necessarily their birthdays, but their kids' birthdays. So then I'll bring something to their kids. So then I have to go to my calendar and be like, okay, this month, who has what? So then I'll do like in the beginning of the month, what I have to buy and who I have to deliver it to, because I go by the kids' birthdays. And that helps, that helps me out.
That reminds me of something. Advanced Orthopedics is a really large group of orthopedic surgeons. Their entire staff is about 110, so it's really big. Really hard to glean that kind of information from all these different people and lots of different players. Referrals can come directly from the docs, from their mid-levels, PAs, schedulers, all kinds of people are touching these patients, and you can get referrals from various different ways. So it's important to have a relationship with as many of the people in that office as you can. So I was sitting there for a lunch one day, and this was years back, and on their wall, they've got a calendar of every single birthday for every single doctor and employee in that clinic. For me to gather that information in any other way would have been impossible. So I quickly took a picture, and later that evening when I'm going, for my wind down, what did I accomplish today? What do I have to do tomorrow? I just dragged that over and built contacts and put their birthdays in. And now it's there forever. And if some of these people come and go to other practices, I just change the name and I still have their birthday and all their information, and it's in that account. So the point is, anytime you're in a hospital, anywhere, church, doesn't matter. Keep your eyes open for what's on the walls, special occasions. In the hospitals, one of my favorite things to participate in are grand rounds. I've never seen another rep in a grand round, ever. And they're specifically for doctors. A grand round, hospitals will host grand rounds, especially large hospitals, and it's an education piece for the physicians. And it's usually broken out by specialty. And I'm not saying I go there and I actively market, because I'm kind of a fly on the wall. It's me in a room of 50 doctors. I'm not even sure I'm really supposed to be there. To be perfectly honest. But they've never asked me to leave, and it's never been a problem before. In the last 3 years with Total, I've probably been to 20 or 30 different grand rounds between a couple of the hospitals that have them regularly, but I wouldn't have known that I could even go there if I weren't paying attention when I'm walking by the physician's lounge. They've got a calendar of it right there. So I just, every month, put it in my calendar, and I know that all the orthopedic surgeons are going to meet this Tuesday at 7:30 in the morning, and all I have to do is show up and sit there and listen to what they have to say. And that's where you can sharpen your tongue, sharpen your skills, learn what's important to them. What are they talking about? That's why I go there, isn't to tell them what I can do. I want to learn what's important to them, so that when I do talk to them, I can make very effective use of that limited amount of time I get.
And you can tell them when you call them, I met you.
Yeah, no,
I met you.
I was at the grand rounds on Tuesday in the Aspen room. And it was really interesting, that new surgical technique. And, it really does. So opportunities are all around.
Another
Keep
good
your eyes
practice is those hospitalists, and sure each office every morning emails you a hospital.
Give it the old one time.
Hello, can you hear me? Another good practice is the hospital list. I'm sure the hospital list every morning, your office emails you who's in the hospital. That list, go through it, see which hospital is yours, go in there, follow up on that. I love to get a referral and that patient's in that hospital for a week, because that gives me an opportunity to follow up on them every day. Get a chance, especially those closed hospitals, get on the floor. When you're on the floor, go talk to the case managers, go talk to the therapist. So that hospital list is crucial to follow up on the hospital list, and also for return of care. Make sure their care might be up when they're in the hospital. Make sure you go in there, visit the patient, make sure they have your number, make sure they call you when they get out, and just visit them every day to make sure we get that resumption of care back, to get that business.
I worked that out.
There you go.
Y'all keep saying that y'all want to help with recurring business. On your SNF patients, how do y'all determine if we have a patient that we're seeing and they need to go to the SNF because family can no longer care for them? Do y'all get involved in that planning, or is that done internally in-house, or y'all have some say-so in that? Because y'all want to feed back to the SNFs that are referring to y'all.
What I do sometimes, what I've done is that hospital list that we get, and that's so crucial that our internal staff gives us that list, because that list is the active patients that we have in the hospital, their cert period. Like Nina said, it's a great excuse for us to be in there, to follow up, to maybe meet new case managers or meet a new case manager that they're on. But also she made up another great point is, if that cert expires or that cert runs out while that patient's in the hospital, that becomes a new admission. And that patient might get transferred from a hospital to a rehab, then to home, and it's very crucial for us to follow up and make sure once that patient comes back, we get it as a new admission.
She wants to know if you guys get involved in
where the patient goes.
Where the patient goes.
Right, so the patient needs to go to rehab because
So if a so taking that a step further, on that hospital hold list I get, if one of my patients that came from Hillcrest Rehab is on that list, I let the marketing person know from Hillcrest Rehab, hey, a patient you referred to us, Susie Smith, is now in Memorial Regional Hospital. Either is going to come back with us with home health, or it might go back to their rehab. So I do make that recommendation to the marketer of that, but that's as far deep as I get.
I think what you may be talking about is active patients that
Exactly.
we're not seeing.
Right.
They're not on the hospital list, they're not in
They're,
the
they're
SNF
at,
right
they're at
now.
home right now, and
They're
our
at home,
nurses are seeing them.
enjoying our care, we're doing a
Right.
great job for them. So the best way to find out and be involved at that level is to participate in your stand-up meetings at your office, your weekly case conferences. Be there to know your clinical team. You know, you may not be able to make it every week. I mean, it takes a couple hours out of your day, but you can be there once a month, get to know your clinical team at your office, and talk to them about, ask them, are there any patients that are looking at assisted living right now? Are there any patients that are having struggles and may need a private duty provider in addition to the services that we're able to offer, especially here in Florida, right? Because we have that sister company here in Florida so that we can provide the provider care. That would give you the opportunity to then follow up with the assisted living or with another provider company and make that connection. And then the other piece of the puzzle, when you're working with an assisted living or provider companies or LTACs, rehab hospitals, give their liaisons an opportunity to come to our office and meet with the executive director, meet with our DCS, do a presentation and bring in some breakfast for our stand-up meeting or our case conference, and let them know, like Kindred Hospitals, they have a direct admit program specifically focused to sell rehospitalization prevention. And so they don't have to go directly to the acute. The Kindred Hospitals are able to take a community patient and directly admit them into that LTAC. Our nurses may not know that. And so we give their marketing team the opportunity to come to our office and educate us and our clinical team, everybody, about what they have, to sell. And so you can get them both ways.
I was gonna say, if your patient is on service, I think you were talking about that even, if they're on service and they're deteriorating enough that they're they're gonna be beyond the scope of home care, try to get your social workers in there, because they're the ones that are gonna be able to assess their financial needs and what they have for income, to be able to wisely advise the family members. They don't, if they have no monies, or they're only qualified for Medicaid, there's no point in showing them a high-end SNF, because that's not something they're gonna be able to go in there. So help get your social workers, because she's gonna know the facilities that we use, and she's gonna be able to assess their monetary needs on what they can afford, because sometimes that's what it boils down to.
Not to put you on the spot, but I hear you say you get a lot of your patients from assisted livings and ILFs and SNFs. How many patients would you say, just roughly, have you referred back to them if you get the majority of your patients from them?
That's a good question. Directly, I don't really refer as much to them directly. I think a lot of times what happens with these ALFs is I introduce them to all my relationships. So I bring them to all my relationships and let my relationships know that if any of their seniors go into this assisted living facility, they're going to allow us to follow. So Total's going to be in there. And I think my people and my resources, my accounts have sent them a lot of business. It doesn't come from me because I introduce the two of them together and then they have a relationship. So I just sort of sit back and get the home health when it comes.
And I think bringing the field clinicians in to see the facilities and have the tours like we've done, we always walk out of there with a clinician or so saying, oh, I know so-and-so that would like to come or needs to come to this facility in this area.
Or partner up with a placement agency rep. She'll know, you know what I mean? Like, if they're reps that they market that, just like placements, they'll help a senior find a assisted living, or, so if, let's say, your social worker
Where are these
Like
people
a
from?
place for mom?
Yeah, like they're called placement agencies. Usually they'll do private home health and they do placement. It's called placement.
So it's an what an ALF placement agency, and they're real big down here in South Florida, and I don't know. It's
We probably don't have one.
No, you don't
Let's
You
get
know,
it over
placement
there.
agency.
You're on an island.
There's like 2 open beds in our one ALF, so.
With you guys, with your success, I think I could tell for some of you guys, what is your relationship aside from the field, the community, versus your relationship in the office staff? Because I know that's vital. You guys have touched on it, Mr. Ryan. Ryan did mention it earlier, having that relationship with the clinical supervisors. Stephen mentioned it earlier. What is your relationship with the internal staff in the office so that it's helping you guys succeed even better in terms of making sure no LUPAs? Can you share that? And how often are you in the office? Good questions.
What was the question?
What is the relationship like?
No, then you said there was another question.
And how often do you visit the office and the office staff?
Go ahead, Nina.
I think it's
To form a relationship with our own internal team? I think it's very crucial to be involved with your office, with my executive director, Jesse. I almost talk to him daily, just bounce stuff off of him. Can we take this patient? Do we cover this area? And it's also your admission team. You have got to make them feel important because they are, like Jesus said, it takes a village to make this happen. It takes everyone from the case managers to admissions to the nurses. Everyone has to feel special. For example, I had a nurse that went way beyond her call of duty for an infusion patient. She stayed way into the wee hours, and I was so thankful. She didn't have to do this, but she did it. She got the patient admitted, and I was so thankful to her. I reached out to her on the phone and just thanked her for doing that, for going beyond her call of duty, and just offered, extend a hand and say, I want to take you out to lunch, just to show my gratitude, and just to keep that connection between internal and sales, because we're not separate. We're all here for the same reason. We're all here to get the seniors on board and to take good care of them. So you have to make them feel they're part of the team, and they're a crucial part of the team. Go around.
Yeah, and also to add on that, I talk to Debbie, I think 5 times a day, and Grace 5 times a day about every little thing. And also processes. We rely so much on our schedulers to get us this hospital hold list. If a patient's cert ends, to let us know. If there's a complaint, because the last thing we ever want to know happen as AEs is be blindsided by an account saying, I can't believe you did this. So the communication, the over-communication, and I think it's just so crucial.
I'd like to know, I have a relationship with a couple of our admitting nurses, and after they admit some of the patients, not all of them, but some of them, like if I have a new referral source, I'll text that RN and say, how was the admission? And I'll give a small report back to the physician saying, hey, Chelsea was just out and she admitted Miss Anderson, thanks so much for the referral. Her blood pressure was under control and her, whatever. She disposed of 3 gallons of pills that the lady shouldn't have been taking or whatever. And they're usually pretty thankful. And, wrapping around that quick, a lot of times we're out there in 24 hours. And so if you can wrap back around with that doctor, let them know that nurse was out there and had a success story for them that quickly, they're usually pretty quick to send you another one.
I don't say that enough, I love my Broward team. Like, I love the office, I love calling my intakes. It just makes the job, it makes me happy when I do well. I'll say, Debbie, I did it for you, or I'll tell my intakes, I did it for you guys. Let them know how you are too. I shouldn't say demands, because that's bad. My rights.
But they are.
That's like a negative tone to it. My preferences, my likes, you gotta let them know. They're not gonna know just, my likes might be different than Steven's and different than Alex's. I like to know everything now. And an email is not now for me. A call or a text is now. So they know. They have to call me. A problem happens, don't email me, because I might read that when I get home. I'm not such an email like everybody else probably, so I need that call or that text. That helps because you're educated before you go into an account if something happens. So that's key. Makes you look good and you have that report with your intake. They know when a referral comes. Text me. Like Zeus one time asked me, he's like, well, how do you know when a referral came? You never check your emails. I'm like, because they don't email me. They call me. They text me. Because I've asked for that, so they know. So just let them know who you are and like what your likes are. And then you become a little family.
I second all that. It's paramount. Something that is always in the back of my mind, and whenever I'm working with a new account executive, something that often comes up is the fact that we can only sell what we have, right, at our office. And the only way to know what we have is to communicate with our nurses, find out what they're passionate about. We may have a gem hiding in there that we don't even know we have. You know, a nurse who spent the last 10 years working cardiac ICU. That's powerful if I could go to a cardiologist or a GP and say, hey, I've got Nurse Jane. For the last 10 years, she has worked at Memorial Hermann in the medical center dealing with nothing but cardiovascular and transplant patients. That's really very powerful. And it goes above and beyond what our CHF program is. This is a flesh and blood person. And this is who's going to be in your home. We're bringing ICU level care to this patient's home. And I wouldn't know that if I weren't communicating with our staff and with our clinicians. And so, and it's the same thing with intake and our entire team. But I sell our intake all the time. We're very blessed to have two in Houston, and one of them is an LVN, Robin. Love this woman. And being a clinician in the intake position, she can do things that other intake may not be able to do, like take verbal orders and be able to communicate on a different level with our referral sources. And so I sell Robin as a clinical differentiator when I'm out in the field. You know, what makes us different? Robin Drummond. She makes us different. You know? That's all I have to say.
With that being said, it's up to the ED to make sure that these guys know what's available to them, because, like Ryan says and Chad, these guys know who is in place in the office. So EDs, make sure your AEs know that you've got these people available, and also ask them to come in. What's that?
Make them come to one case conference.
Absolutely.
If you have a new employee or
Ask your ADs to come in once a month. That's what we do. We meet the first Tuesday of every month, and we meet face to face, and they get to meet the employees. So that's a difference.
Or not.
That's right.
Right, exactly. He travels, what, 40 miles to the office?
Yeah, it won't
Like
get wet.
75.
And it's funny, I've had compliments out in the field, doctors' office nurses and stuff like that, sometimes patients, and they'll be like, "Your Nurse Ginger," or "Your Nurse Peggy," and I'm always like, oh my God, I have no idea what they're like. I've never met them. And then in one of those luncheons, I hear that, somebody's talking and they'll be like, "Oh, Ginger this," I'll be like, "You're Ginger?" So then it's like, you gotta make the effort. What? What?
What about compliments on the guard?
Oh, we got a lot of those.
Zeus, you were still the screensaver for one of my social workers on her computer. It switches because the screensaver has been for like 2 years.
That's true. The people that know you when you say Zeus.
I was just gonna say, the most things that I hear from the AEs, they just wanna be in the loop. They work, they hustle, they work hard to bring those referrals in. They wanna know that they were open, and they wanna know if there's a blip of whatever it is. If it's not gonna open in that next day, why not? Patients have the right to say, I want it the next day, or something, I got doctor's appointment, it needs to be. Just let them know that. Let them know that there is. If they can't find their address, we can't find them, because sometimes we can't, the addresses are wrong, or they didn't go home, they went to their daughters or something. We do drive-bys and stuff like that to try them. If we can't find them, let them know. The phone numbers, all the numbers we have, emergency contacts, everything, nothing's working. Let them know. The worst thing for them to do is walk in the doctor's office and say, why didn't you see my patient?
And we're like,
Because they called me back and said nobody showed up. They don't want to walk in and hear that. So That's the one thing I hear day and day. Please, let us know that they open, A, you got the referral, B, it's opening in 24 hours if not, and any little bump in the road. Any little bump in the road.
What helps my admissions also?
They paid me.
I'll give you the money later.
If I may add with that, it goes both ways, okay?
True story.
It does go both ways. I can definitely vouch for the two up there from Broward. You have to humble yourself to know also our internal staff. That's why I ask, because I see the success of those two. They don't just get emails from the ED or the DCS. They get emails from our schedulers, letting them know that their patient is possibly a LUPA and is short by 1 or 2 visits, just because, you know, things like that. They get that email, they get that text. As much as we want you guys to be in a loop, I want you guys a success. You guys need to meet the schedulers because they're the peoples, aside from the clinicians, the schedulers are your vital people as well that will make sure your patients are seen. More than anything, show them appreciation. Steven comes there, shares peanuts. Audrey says hi, or anything. Brings donuts, whatever. Alexandra did that the other day too as well. So please, it goes in the loop like Steph said. You want to be in the loop, you also have to show and let them know who you are to know that I have to let you know that your patient can be a LUPA because the patient is refusing. Can you help us? The clinical supervisor couldn't speak anymore. Maybe you did because you saw that patient at the facility and they know you more. So that's one of the things too.
Hey, I want to tell you guys something. Remember that everyone that sits at the intake department, they're human beings. They make mistakes. You're not perfect. They're not perfect. Don't call the office screaming at them. They're the problem. I'm the solution. They're humans. They got families just like you. Don't make them cry. They work so hard for you guys. So hard. They're there before anybody else and they leave later than everybody else. When was the last time any of you wrote them a thank you? Out of lunch. You got a big fat check for your bonus. You buy them lunch? You call them and say thank you? Don't forget that. They're always there sitting there fighting for your patients. And they're scared half of the time that you're going to scream at them. It's not fair.
We had a really nice experience with Steven. Steven in the Miami office is known as being painful. And then, he follows through, he calls, he makes sure that the patient is admitted. He doesn't take a no for an answer. When orders are all, okay, why, what is happening? And so, it's being, that's the reputation. And one day, Steven showed up with a big cookie pie and gave it to the staff. And he went and said thank you to everybody from the schedule.